So we've got a question from one of our subscribers. He has asked us, he has got this tooth removed 10 years back. Somehow he never found the time or his resource to get the teeth replaced. Because of that, over a period of these many years, his face appearance has changed, giving a very old age look. So his question is specifically, if I get an implant treatment done, can I improve my facial structure? So that's this question. So let's answer that particular question in this video. This is Dr. Arun from Pearls Dentistry, running our dental centers at Chennai, Raja and Namalaipuram since the year 2001. If you have not subscribed to our channel, please do subscribe to our channel. We've got a whole bunch of videos coming out on dental education and awareness. Now first, in our previous videos, we have spoken about residual ridge resorption at length. Briefly, I will explain what that is. So once we lose the teeth, the bone that supports the teeth is called alveolar bone, both for maxilla and the mandible, maxilla being the upper jaw, mandible being the lower jaw. So once we extract the tooth, the alveolar bone which supports the teeth does not have function. Because it does not have function, it undergoes a process called resorption. Resorption simply means the bone gets reduced in volume, both in height and width, and the quality of bone also gets reduced. This is called resorption process. It's a normal physiologic process. Sometimes it gets accelerated if the reason for whenever we don't replace the tooth. So now this is what is happening. So when you do an implant replacement, typically we decide there are so we do what are implants called root form implants. Basically, root form implants means that the implant is supposed to mimic the root of the lost natural teeth. That's the reason it's called a root form implant. So on the implant, we give what is called a crown. The crown is attached to the implant through something called the abutment. So we have an implant which mimics the root of the lost natural teeth. So to answer our subscriber's specific question, so when especially this change in facial appearance happens when you have lost multiple teeth, just not one teeth and multiple teeth, and then when the multiple tooth is lost, there is corresponding loss in bone that supports the teeth and also corresponding loss in the soft tissue that was holding the bone. Also what happens is the bite, that is when I mean the bite, it's the way the upper and the lower teeth joins. There's a lot of changes in the bite that has happened. So eventually it gives an appearance of an old age look. So what the patient means by the old age look is either because the bite is collapsed, the way there is no upper and the lower teeth, so this area between the nose and the chin becomes much reduced in size. One. Two is because there's not tissue support there, bone has lost, soft tissue has lost, teeth is not there. The cheeks get sunken inside. So this is what gives the old age appearance. So now when we replace teeth, what we not only replace teeth, especially when we replace multiple teeth with multiple implants, it is also, we plan it in such a way that we also replace portion of the lost bone structure and the portion of the lost gum structure. How we do? So even though it's a root form implant, it will not only just look like a tooth as well as the implant and the crown on top. The crown on top will have, we can do a pink ceramic or a pink porcelain to make it look like a lost gum structure. So that's how we replace teeth. We can do a complete treatment planning prior to the actual replacement, where we will before we actually do the implant, we actually do the surgery. We will then do the lost teeth that the patient has lost. We will do what is called a build-up in a racine teeth, and then see how much of tooth structure that needs to be, how much of tooth that the patient needs to be replaced, how much of bone structure, how much of gum structure that needs to be replaced, and then plan an implant treatment planning accordingly. Just a disclaimer, a word of caution: 10 years patient has lost. We should also understand in the 10 years patient has aged. So whatever the skin structure that has changed, whatever the skeletal structure that has changed, we need to account that also in our treatment plan. So it might not be possible to get the 10-year-old younger look there, but to a large extent we'll be able to replace the lost tooth structure, giving that kind of a natural look to the patient. So hope you like this video. If you have any questions, please do ask in the comment section below. Until next time, Dr. Arun from Pearls Dentistry. Please do subscribe to our channel and then share the video if you like it. Thank you.